Hi everyone, and welcome to this episode of the Liver and Guts podcast. My name is Dr. Kash Gupta. I'm a gastroenterologist and hepatologist in the UK. And today we're going to talk about something that affects millions of people, type 2 diabetes, but more specifically, how your liver can cause diabetes, something which I think most people don't really think about. And also, how you might be able to reverse it. Now, here's the thing. I'm not going to tell you all the things that you possibly heard before about diabetes necessarily. I'm going to try and share something that may surprise you. And for a long time, doctors thought that type 2 diabetes was a one-way street. Once you had it for life. You'd need more and more medication over time. But now we know that's not entirely true. And many people can actually reverse their diabetes. And the key to understanding how starts with the liver, which is the surprising fact. A lot of people don't think about this aspect. And today I'm going to explain a simple idea called the twin cycle theory. It shows us how diabetes develops, and more importantly, how it can be undone. And there are a number of clinical trials which were run by Professor Roy Taylor in Newcastle on this, called Counterpoint, Counterbalance, Retune, which looked at the personal fat threshold, and the direct trials. And they kind of span between 2011 up till now. I'm not going to go too heavy on this because I think sometimes I make these videos a little bit too complex, and I want to make this really simple, and we will try and give some free documents and information on this because and references to Professor Taylor's link at Newcastle University, so you can read more about this, because I think it's really fundamentally important to metabolic health, and most people aren't aware of this, and even in the specialist physician level, I don't think we're doing enough to tackle this. So let's set the scene. Before we dive in, let me try and explain a bit of background. So when you eat food, your body turns it into sugar, which is glucose, for energy. And to get that sugar from your blood into your cells, you need a hormone called insulin. And think of insulin like a key that unlocks your cells so sugar can get in. And in many people who develop type 2 diabetes, their muscles don't respond well to insulin. We call this insulin resistance. And the key doesn't work as well as it should do. This can be partially genetic. You can inherit it from your parents. It can also happen if you don't move much, you're a sedentary and put on weight. And so for a while, your body can cope. It just makes more insulin to compensate. But this sets the stage for problems down the road. Now, let's look at the liver problem. It's where things start getting interesting. So I think Professor Taylor explains all this in better detail and has a fantastic way of explaining it. And I'm really going to try and keep it simple for the audience so we get a clear picture of why the liver is important. But Professor Taylor from Newcastle University figured out that the liver plays a much bigger role than what we thought. And here's what happens. When you eat a bit more than your body needs, not a lot, just a little bit over months and years, that extra energy has to go somewhere. And one place it does go to is your liver. And your liver starts storing that energy in the form of fat. Gives you a fatty liver. A fatty liver causes two problems. Problem number one, your liver stops listening to insulin properly. Normally, insulin tells your liver to stop releasing glucose and sugar into the blood. The liver is the regulator for sugar in the blood. But a fatty liver ignores that signal, and it keeps pumping out sugar, even when you don't need it. And this is why people with diabetes often have high blood sugar in the morning. Even though they haven't eaten all night, the liver keeps making sugar while they sleep. Problem number 2, your liver starts shipping fat to other parts of your body. It packages that fat into little parcels called VLDL, very low density lipoproteins, and within them they have something called triglycerides, and they send them out to your bloodstream. And one place that fat ends up is in your pancreas, which is a problem. So why is it a problem for the pancreas? Well, the pancreas makes insulin. So when fat from the liver arrives at the pancreas, it starts to clog things up. The cells that make insulin, called the beta cells, start to struggle. And here's something important to understand about insulin. When you eat, your pancreas normally releases a quick burst of insulin right away. This fast response is really important for handling the sugar from your meal. But when your pancreas gets fatty, it loses the quick response. The beta cells become sluggish. They can still make insulin most of the time, but they're slow. The result? Your blood sugar spikes too high after meals. And here's the vicious cycle. The high blood sugar causes your liver to make even more fat, which gets sent to the pancreas, which makes things even worse. And this is why it's called the twin cycle theory. 2 cycles, the liver and pancreas, feeding into each other, making diabetes worse and worse. Eventually, when your pancreas becomes exhausted, you'll have permanent diabetes. So the idea is to try and reverse it before that happens. So let's put this all together and let's generate a whole picture. Type 2 diabetes isn't just about the pancreas. It's about fat in the wrong places, specifically fat in your liver and then your pancreas. The 2 cycles work together. The liver causes high blood sugar, especially in the morning, and ships fat to the pancreas. The pancreas cycle causes high blood sugar after meals and makes the liver problem worse. And together, they create type 2 diabetes. But here's the important bit. If you can remove the fat from the liver and then the pancreas, the cycles stop. Essentially, if you move fat away from the liver, you can stop the cycle. There's a diagram which you'll be able to see regarding the twin cycle hypothesis, and I know it's a little bit complicated and it's got terms, but I didn't really want to simplify it because I think it's about as simple as you can get it in terms of really understanding what's going on. But this cycle, twin cycle hypothesis, which identifies how the liver fat is the first initiating factor for diabetes, is really, really important to understand, because many people will develop liver fat and they just don't know it. And if you can identify that first, which we try and do in the liver field, because we know it's associated with many poor outcomes, people have a chance to just not even get to the stage of diabetes in the first place. So it all sounds nice in theory, but does it actually work in real life? Well, Professor Taylor tested this with real patients. He put people with type 2 diabetes on a very low calorie diet and watched what happens inside their bodies using scans such as MRI and various blood tests, including your lipid profiles, insulin levels. And here's what he found. Within 1 week, liver fat dropped significantly, and morning blood sugars started to improve. Over the following weeks, pancreas fat dropped and insulin making cells started to work better. The beta cells started working better. And by the end of the study, many people had normal blood sugars without any diabetes and not needing their medication anymore. Then came an even bigger study, which I mentioned earlier was the DIRECT trial, done by ordinary GPs across the UK, and nearly half the people who followed the weight loss program went into remission, meaning their diabetes went away. Just so you know, the weight loss program, in terms of a low-calorie diet, was a food pack which was prepared, so it took the choice away from the patient, so they didn't have to worry about what they needed to eat, and that was around 600 calories, and they were allowed to eat some low-carbohydrate vegetable salads around it to keep the gut integrity microbiome going, making them have less symptoms because they've got some solids in their bowel. And overall, for people who lost the most, 15 kilograms or more, 86% achieved remission in diabetes, which is absolutely amazing. People off medication. And I imagine a lot about how people who I see every week in clinic, referrals every day, family, friends, you can spot the liver fat on them. You think about how close they are to diabetes, therefore all the metabolic syndrome is there, risk of heart attack is high, stroke goes up, cancer goes up, and you look at your friends and family and you think, you can observe it, even without doing scans. And so being able to know that information is so important, because I think a lot of people will change their behavior. But there are important caveats, and I need to be honest, it doesn't work for everyone. There are two things that need to happen for remission. First, you need to lose enough weight to be clear of the fat from your liver and pancreas. And for most people, this is possible with the right support. The second thing is your insulin-making cells need to be healthy enough to recover. And if you've had diabetes for many years, perhaps 10 years or more, these cells are much more damaged and perhaps less likely to recover. And so this is why timing matters. And the earlier you act, the better your chances of success. And people who've had diabetes for just a few years have better odds of achieving remission than those that have had it for decades. That doesn't mean that it's not worth trying. You may well be able to reduce the amount of medication and feel better, more importantly. The other important thing is that you have to keep the weight off. If you lose weight and then gain it back on, the fat returns to your liver, and then the pancreas, and the diabetes comes back. The other important things that Professor Taylor highlighted was that people that weren't able to stay on the program often didn't have family support. Their spouses didn't want them to lose more weight for whatever reason. And eating is a social thing, so having that kind of support around you is key to success. And the other thing that was mentioned, and we'll perhaps do a video on this, is compensatory eating during new exercise. So if you go on a new diet, and if you go on a new diet and you try and do additional exercise at the same time, people would tend to compensate for the energy balance by eating more, and they wouldn't lose weight as much or not at all. And that's an important factor that he mentions that a lot of doctors don't think about, which is compensatory eating. And actually, there's good data out there on compensatory eating and how people won't lose as much weight over a period of time. So his points were that after the 8-week period of considerable weight loss, and it was 8 weeks, which was brilliant, that after that, then trying new exercise helps keep the weight off, which is evidence-based as well. So what does that mean for you? What should you take away from all of this? Well, number one, diabetes is not always impermanent. And for many people, especially if caught early, it can be reversed. And that's generally good news. Number two, it's about fat in the organs, not just your weight. Some thin people get diabetes because they store fat in the liver and pancreas. Some larger people don't get it because their fat stays under their skin. It's where the fat is that matters. Number 3, earlier is better. If you've just been told you have pre-diabetes or early diabetes, this is your window. Act now while your body can still fully recover. Number 4, the liver is key. And that's the most pertinent thing for me as a hepatologist. We used to focus only on the pancreas. Now we know the liver is where it all starts. Fix the liver and you can give the pancreas a chance to heal. Number 5, lasting change is what counts. This isn't about crash diets. It's not a crash diet. It's about finding a way of eating that you can stick with your life. So, final thoughts that I want to leave with you today. For too long, people with type 2 diabetes were told that they had a disease that would only get worse. Take your pills, accept your fate. The twin cycle, and that's certainly what I was taught at medical school and as a junior doctor. But the twin cycle theory changes that. It tells us that diabetes isn't a life sentence for everyone. It's often a reversible condition, and if you understand what's causing it and take action, that's incredibly empowering. And I'm not saying it's easy. You need family support. Losing weight and keeping it off is a challenge sometimes. You need commitment, patience, and a plan. You need a plan. But knowing that there's a real chance of putting diabetes behind you, that's worth a lot. And there are videos that I'll make in the future about what it means to have how much fat in the liver, what your personal fat threshold means, which Roy Taylor has shown that even thin people with a BMI of normal 21 to 27, 20 to 27, those relatively thin people, as they get older, can still put on weight and get above their fat threshold. So BMI is a very rough tool for monitoring whether you're going to be at risk of disease. It is helpful, but you can have a slim person who had, for example, a BMI of 20 when they were 25, and then have a BMI of 24 when they're in their 40s and be above their fat threshold. So that's key, trying to keep the fat out of the liver. And I'll do further videos on this, that over-exercising, lots of exercise does not mean that you can take out all the fat from the liver. It helps, but what you eat and the energy balance that you take is very important, the most important thing, which has been shown by Professor Taylor's work. So if you or someone you know has type 2 diabetes or pre-diabetes, share this with them. Understand how the liver and the pancreas work together might just be the first step towards a healthier future. And thank you very much for listening. Take care of your liver. It's doing more for you than you realize. And I'll see you in the next video.